Good morning, dear viewer. This is the Morning Scoop. I'm so glad to welcome you to have a conversation on matters nurse and training medical personnel. Let's look at healthcare workers and who they are in general. There are some programs or some courses or activities or services at the hospital that we don't interact with on a daily basis, but they're very crucial. We are going to learn about them. But a nurse, being a nurse, is a very visible person in a hospital setting. So because a nurse is visible, so we'll start with a nurse, then we'll go into other areas. Today I have a guest who is going to introduce himself, and then he will take us through to the rest of the conversation. But then, as I said, matters healthcare or service delivery in a health organization, it needs specific art, it needs specific dedication. At some point we call it gifting, because some of them could be gifted in that area. So let's just talk about this and learn a bit of what we are going to learn today. On behalf of the director of the show, Kelvin Kibet, my name is CKS. I want to invite you to take advantage of following us on our social media, WestTV_Kenya. Facebook is WestTV. You can follow me at Mr. Kitui or Wasemite CKS on Facebook. Leave a comment and share. This show is on YouTube. Please, whenever you're on our social media, leave a comment. We're on Instagram, we're on TikTok. Leave us a message, a comment, share, subscribe, and join the community. Thank you so much for joining the show. My brother, you're welcome.
Thank you so much, Mr. Smitty.
How is Kisumu?
We are doing so well, we thank God.
Yes. You see, Kisumu is on the other end.
Yes.
We are the other end.
Yes.
But we are connected, right?
We are connected.
The only difference is that there are dark guys from there, very tall and dark. How come you are short and a little...
Yeah,
I'm taller than you and I'm proud.
Yeah, of course, when I was reading books of history, that is when I noticed that there are different physics of the different communities in the country.
Yes.
So then, of course, intermarriages came, and then biology also happened.
Yes.
And we get to have different statures of people.
Yes.
In our communities. Actually, my brother is way taller than me and dark.
Okay. So you're the one who was correcting the family height.
Maybe.
It's all right. It's all right. Thank you so much.
Thank you so much.
Please tell us your name.
My name is Derick Omondi. I work for Johhannes College of Medical and Health Sciences. Yes.
On the show today, we begin with the proverb. It says, "A tree with strong roots laughs at stones."
Okay.
How do you understand that?
A tree with
strong roots laughs at the stones.
At stones. Why? Okay, that's a difficult one. Of course, I understand a tree that has strong roots to be very, very stable. That may not really be flushed out if a storm comes. However, I'm stuck at comparing that with them laughing at stones. Yeah, maybe you can help me with that.
Let's talk about nursing in Kenya. Generally, we are in the Western Kenya part, and this region we export a lot of healthcare workers. Out there. We walk around Nairobi, Mombasa. You're going to interact with a lot of nurses from Western Kenya, not just nurses, but healthcare workers in most of those areas. It means these artists called nurses, we have quite a bit of them.
Yeah.
Let's just start there. They usually come with a human touch.
Yeah.
There is empathy. Whenever they're delivering a service, they make the patient like them.
Yes.
Secondly, they're very visible in an organization, in any hospital setting. You are going to see one doctor, one pharmacist, one lab guy, but a host of nurses. They're very visible,
Yes.
to the point that some of us call them doctors. Yeah. Now, just introduce to us who a nurse is.
From my experience training nurses, I have of course interacted with a lot of students in my line of duty. Before working for the current college, I was working at a different college, and within the vision of just having some of these institutions was a call to get more nurses. Because you notice that these are the frontline healthcare workers that are the first point of contact with most of our patients. So these are people who are really important in the healthcare sector.
Yes.
And in my journey of working with them, I have been inspired to create nurses who are superhuman. I mean, apart from the nursing training, giving them the skills they need, but then they should have some an extra humanity in them to enable them handle the work that they do.
Okay.
Yeah, because they meet people at their lowest moments. You'd imagine meeting someone the age of a parent in their lowest moments when they cannot even control their bowels.
Yes.
And probably they are so sick that they cannot even do some of the basic things that they're supposed to do. So then these are people who are pretty very much important in this line of healthcare work.
Okay.
And you really need to appreciate them more.
You see, we have nurses.
Yes.
When you enter into a hospital setting, of course, those with advanced systems, they will start by employing a customer service relationship officer.
Yes.
Then you will see some other non-medical staff hovering around.
Yes.
But in most of primary healthcare services, the first person you interact with when you enter is the nurse.
Yeah.
So we have nurses,
Yeah.
but then these nurses are not the same.
Yes.
We have nurses who work in different sections of the hospital.
Yes.
What are those? How do they differentiate that this is a casualty nurse, this is a maternity nurse, this is a theater nurse, this is a what those kind of, how do they arrive at those, and who is this person that is divided into very many centers?
Just to bring that to light is, of course, a lot of nurses, or a lot of those who are interested to work in the field of nursing join the course as a nurse.
Okay.
But along their study, during the when they're exploring most of these units, because nursing has pretty much a lot of other subunits in it.
Yeah.
So then, in the line of their study, they find their passion in one unit of this nursing. And so this is where you are going to find someone probably by the end of their course, or a few years into their practice, they'll find themselves more inclined to working with children.
Okay.
You're going to find some of them who are bold, or probably some of them who went for some of these specialized trainings, and probably have ended up loving to work as fast responders.
Okay.
And in such a way makes them now put in the different sections within the hospital. Yeah. So probably during allocation of duties, or probably during promotions, probably a nurse who was a general nurse would be placed to work at the casualty.
Okay.
Because it has been noticed that they are quick thinkers who are able to help within the casualty areas. There are those who are probably super good with children and are left to work with children, pediatric nurses. Yes, and there are those who probably have had advanced training and are probably working at the theater.
Okay.
So then you're going to have theater nurses.
Then you have a nurse aide.
Then you have a nurse aide, exactly.
How do a nurse aide differ with a normal nurse?
I'm now probably in my journey. I know probably this is not within the professional cadres yet, but I'm sure that the relevant stakeholders are going to have this into consideration, because from what you notice, as late as this year, I had around 3 aged individuals who came to me and told me that, Mr. Derick, I was trained as a nurse assistant in the 80s, and I have a certificate from a hospital but not from an educational institution.
Okay.
So then they wanted to come back to get trained within an educational institution, so that now they have a recognized certificate. So nurse aides or nurse assistants or healthcare assistants have been in training for quite a long time.
Do they start a formal training in an institution,
Yes.
or they learn on the job?
Initially, they were learning on the job, but of late now, the different regulatory bodies have introduced their curriculums.
Okay.
Like NITA has introduced a curriculum. We have a curriculum from TVET that is training healthcare assistants. So traditionally, they were being trained on job, but right now, they have a formal training in school.
Okay.
After which now they go and do this within their areas.
How long is the training? Months, years?
The training lasts from between 6 to 1 year.
Okay.
Yeah, exactly.
You see, most of these nurses, you see, when you enter a hospital,
Yes.
chances are you're going to interact with the nurse from the triage.
Yes.
Okay. No matter where you go,
Yes.
the nurse will be assisting you all the way.
Yes.
After triage, you are likely going to see the doctor,
Yes.
who is going to refer you to a specific specialized services.
Yes.
You're going to meet a nurse there.
Yes.
This nurse may not be a technical person in that area, but the same nurse will be guiding you.
Exactly.
In your understanding,
Yes.
do you impart this at the training stage, or they pick it up along the practice?
So because from my experience, just like what I've told you, I've gone through the nursing curriculum, and I can tell you that it is very vast. It is very vast, and it is very wide. And now that they are usually exposed to these patients, because they spend a lot of time with these patients, then they grow attachments. Nurses are trained to get attached to patients.
Okay.
And they are also trained that even after getting attached to a patient, then there is at a point then where you are now supposed to detach. But unfortunately, for us Africans, our attachment comes different. It stays. it stays for quite a long period of time, and as such, then they have been people who have been able to help the patients in all the relevant areas or sections where the patient is going to pass through.
You see, and they are very critical to the management of the patient.
Yes, they are.
I remember interacting with some specialist, and he said, whenever I go to a hospital, if I go to Aga Khan Hospital, I'm not interested with what the doctor said. I'm interested with what the nurse has said.
Yes.
The notes by the nurse is what I'll go with, because she is the one with the patient.
Exactly.
That proximity to the patient, by way of interaction, maybe assisting them, understanding them, building their history, is what will help the delivery of that medication to this patient.
Yes.
And what I've never known is whether in a classroom you teach that this is what you do. Yes. I'm exploring the giftedness, because there are some of them who are so dry, they are very not human whenever they're dealing with patients. I was a young kid at some point. I was at Kitale, those days it was called district hospitals, and some nurse came around and said, some of you women are smelling, you see. and the wrongness of which they deliver services, that's not for the human nature, human face. But then the others, what they say is what the doctor will do.
Yes.
So is gifting playing a role, or what is it?
Now, a lot of this is nurtured in schools, and I would give probably examples of nurses who have gone through the diploma level of training, that they interact with patients immediately they get into training. At around 4 months, this nursing student already is interacting with patients. Mm-hmm. So by the time they are completing 3 years, they would have interacted with patients for a long time, such that, I mean, their training is really knitted with the nursing practice. Mm-hmm. So you find probably these are nurses who probably going through the curriculum, which is also very nice. And I'd like to applaud the Nursing Council of Kenya, because their curriculum, the curriculums that they allow schools to use are very good curriculums. Mm-hmm. And even the regulations that they do in regards to the schools that teach this course is something that is very commendable. Mm-hmm. So then this impacts the level of perfection that a student lives with him or her throughout the training period. Mm-hmm. So of course there is gifting, but you see, if we are impacting something in a student for 3 straight years, yes, then you're sure that is something that is going to stay with them permanently.
It will last.
It will last.
Yes.
Yeah,
you see, some of them are called registered community health workers.
Yes.
Or nurses.
Yes.
So nurse aides also join that, or what are they?
Yeah, of course, like I stated earlier, the government is yet to give CNAs a cadre. Mm-hmm. A lot of private hospitals, although, have taken in nurse aides, yes, because they help nurses with the bulk of their work as well.
Mm-hmm. Yeah.
So this is yet to be taken in by the government, but already it is allowed within the private healthcare setups, as well as the international market, that are really taking in these nurse aides.
You see, at some point, clinical skills.
Yeah.
On one hand, we have the clinical skills, mm-hmm, then we have personal attributes.
Yes.
Then this is a human being. Mm-hmm. The compassion that you have as a human being towards another. Mm-hmm. So you put in the clinical skills, and then you deliver a nurse.
Yes.
Yeah. Mm-hmm. This smart angel called nurse, yes, is designed to work with a patient, work with a patient, and work within a hospital setup.
Yeah.
Locally, I don't see that a bit, but I'm starting to see that happening in major cities, yeah, like Nairobi. Mm-hmm. I have 2 people here in Bungoma who are using that. Mm-hmm. They don't go to hospital. These nurses come to the home. Mm-hmm. They're trying to exploit the clinical skills, mm-hmm, and then personal attribute of this particular nurse. Mm-hmm. So the patient will say, I want nurse so and so, mm-hmm, to come and serve me.
Yeah.
Okay.
Yeah.
My thinking will be, mm-hmm, what does it do to others? For example, there are a pool of 5 nurses. Mm-hmm. Then a patient picks one. Mm-hmm. What happens to the 4?
Of course.
And whether these nurses are prepared for that.
Yeah, of course that your experience from what you're describing is what gave birth to nurse aides. Because you notice that probably within a facility there is that one passionate nurse, mm-hmm, who is very good with patients. So then some of these patients who probably are done with treatments within the hospital setup and now have been recommended to complete probably part of their treatments from at home, yes, then probably used to call these nurses to come and work with them back at home. So then this is what birthed some of these nurse aides.
Okay.
Because then now the nurse would go and check on the patient, and then now because they are more skilled and are still required back in the facility, then they would bring in a nurse aide to help them sit with the patients under the instructions, because then they would tell the patient that, you see, this patient of mine, this is how they would love to be treated, and this is what is needed to keep them going in their course of treatment. Okay. Yes.
So it doesn't have any impact whatsoever to the nurse who was passed over.
Yes.
I want Nurse Kitui, not Nurse Derick.
Yeah.
So Nurse Derick will start to say, why is he?
No, of course there are different ways people interact, and of course how people get attracted to each other. So that is there, and of course patients have their rights within the facilities to also have the person they prefer, which is something that probably we leave to them. You don't want to find that with them.
But then work can be demanding.
Yes.
Mostly it actually gets very demanding.
Yes.
And these nurses have families.
Yes.
How do they manage stress, work demands, family demands? Are they prepared from training level, or let come what may, we will manage it along the way?
Also, so the world over, of course, African nations and Kenya are still being not able to absorb enough manpower for its population. I would give examples of private health facilities and facilities probably out there in developed countries, where because of a high demand for nurses, then the gap is being filled by nursing assistants. Now they step in so that these nurses are not overweight, because they have a lot of work that they do within their shifts. And just like I told you, they are partially prepared, and that is why you'd encourage nurses to train in facilities that are accredited, because then these are people who have been really prepared to deal with training nurses and prepare them for the harsh realities of the nursing profession.
Yes. And then you see, apart from nurse, you see, in a hospital there are services. Okay. Triage is a service.
Yes.
Then laboratory is a service.
Yes.
Then physiotherapy is a service.
Yes.
Any other service in there, it means there are workers who are trained. Sometimes they will need counseling, which is a service.
Yes.
I don't know what other services are needed. And apart from the nurse, who else is crucial to the delivery of a healthcare service? Especially on a primary level, because all these services need personnel. It's not just nursing. We keep on talking about nurses because they're all round. They can do anything. They can inject, they can do lab, they can do all those. But these services need specialized services.
Yes.
At some point we have maternity wards. In a maternity ward there are sometimes there is that chaotic ward inside the maternity setup, and then you see there is theater. You see, all those are different services, right? It needs different personnel to be trained. Just tell us a bit of other services apart from the nursing department in a hospital setup, and at the training level, by the way.
Oh, thank you. Probably at the training level, I see the government really trying to enhance primary health care in regards to working with community health promoters. And in this regard again, we urge our viewers that you are out there and probably interested in working in some of these departments. You can go and study community health, because these are very crucial people that are going to help working, probably addressing the primary health that the government is really trying to address. Yeah, of course, these are areas that we are offering as a college, and you're out there at the facility. Apart from the nurses now, there is a key critical area that is sometimes overlooked with specialties, that is the theatre. And in the theatre,
inside the theatre, we have theatre technicians.
Yes.
Then we have theatre nurses.
Yes.
Okay.
Of course, now these are people that have been quite overlooked initially, but really coming out to be really bold and noticeable right now. So then there is a high demand for theatre technicians.
What do they do?
Theatre technicians assist in the mechanical issues or working
with the equipment.
Exactly. And assisting within the theatre during operations.
So you are saying,
yes,
we have mostly the clinical officers who do they're called what? The killing part is called what?
Anesthesia.
That one. There is that doing anesthesia.
Yes, that is also done. There are nurses who've studied that as well.
Nurses are doing that.
Yes.
Then we have a technician.
There's a theatre technician.
And then there is now the
surgeon.
The surgeon.
Yes.
Okay.
Exactly. So the theatre technician has to prepare.
Nowadays, we're also working with technology.
Yes.
So do you want us to have another person there handling the technical part of IT that is being used inside the theatre, or what?
Yeah, of course, the theatre technicians are prepared in regards to the technology that is used within the theatres, just as the surgeons are also trained in that line.
Okay.
So the theatre technicians are all round prepared and trained to help in all the equipment within the theatre.
The support system in the theatre,
yes,
is what? The lamp? What else? The bed? That PPP machine? What else? And
of course, there is infection prevention, which is a key section within the theatres, and the theatre technician makes sure that this is adhered to strictly.
Okay.
Because infections within the theatre are something that can really mess the whole process.
Any slight exposure to strange things,
yes, pathogens,
lead to infections.
Exactly.
Okay.
Exactly. So the theatre technician prepares the theatre so that it is sterilized and everything in it, right from the surgical bed to all the equipment that is going to be used during the surgery, is prepared and is in direct control of both the theatre technician and the surgeon in charge of that.
Okay.
So then these are people who are crucial, and as it is right now, their demand is very high. Yeah, because of course a surgeon would be leaving this theatre headed to a next surgery in a different facility. We are going to have a stationary theatre technician within a theatre in a facility, to ensure that within the next minutes that the next patient is being wheeled in for surgery, the theatre is prepared for the same surgery.
Okay.
Yes.
But then they can also do anesthesia, right?
No. Theatre technicians
don't handle the patient at all.
They don't handle the patient. They assist in all that is going to be needed,
but then not touching the patient.
Not
Hallelujah.
Touching the patient.
Because I want to imagine someone with okay, that's fine.
Yes.
Then there is a lab technician.
Yes, it's a lab technician.
Now, that was a theatre technician.
Yes.
A lab technician.
A lab technician.
What does it do?
Lab technician, pretty much what the theatre technician does in the theatre. We have a lab technician that assists in the lab.
In the lab, okay.
Yeah. So of course, lab technicians are trained now. Apart from just handling their equipment, they're also trained to
do the tests.
Yes, to do the tests.
They cannot do all the tests.
They can do all the tests,
okay.
Of course, according to your training levels and where you're trained. So you can diversify as time goes. Yeah.
And then we have the pharmacy.
Yeah.
Those personnel at the pharmacy, they also come through the same training arrangement. They interact at training level with nurses, with the clinical officers, lab technicians, now theater technicians.
Yeah.
So they interact in the same setup, right?
Yes, they do.
But they're only taught to learn a language written in English.
In their own handwriting. That is not I think it is their own language.
Whoever designed that vocabulary should be given a soda and a flower, because that vocabulary is only known in that setup. Between them and the doctor.
And the doctor. They're the only two people who understand that language.
So this guy, he doesn't have to be a human. He just have to be somebody who can understand and dispense the medicine.
Yeah.
But then some of them have human faces, and they actually have, as in it's a human side of them. It could be the same as what you said. Those attributes could be picked along with the practice, or maybe trained, right?
Yeah, exactly.
But then they're there, and I've never liked them. Have you ever seen someone who owns the world? They sit in the pharmacy, like they have no care of anything.
Okay.
Only money. And they give you money, and they give you the drugs. Why is it that way? Is it the business side? Okay, it's the business side of the hospital.
Yeah, probably I would look at them differently.
Okay.
as people who probably you rarely interact with, but are still crucial in the healthcare setup. So we need them at the end of the day, because they are not only trained on dispensing drugs, they are trained on dispensing drugs for that particular ailment that has been diagnosed. So within the interactions, they would probably, a nurse who has brought in a prescription from the doctor, they would discuss with the pharmacist that, hey, do you think this medication is going really to work? Because in my experience, all of them along the line are trained on pharmacology. Yeah, so of course the nurses have it on a more advanced level, but then
pharmacology is what?
Pharmacology is a unit in pharmacies, in a pharmacist's training.
So the nurse gets the training?
The nurse gets the training. The doctors get the training.
Okay.
Then now the pharmacist now gets it in a more advanced level.
Because now that is his area.
That is his area. But then again, they get trained on how this medicine is going to interact with your body. So even as the doctor prescribes your medication, the pharmacy understands how this medicine is going to interact with your body.
Okay.
Of course, some of them have been mean. I know we interact with them at the public health facilities, where some of them may, because of the difficult work environment,
the pressure,
yeah. But you get down to talk with them, then they're just normal human beings who have experience in their own field. Yes.
Interesting. Let's look at the training level. Let's go back at the training institution, where in a classroom it has to be hands-on, because can you train a nurse online? Can they do online courses? This has to be hands-on type. You have to be there, have to be here, have to show you, because this is a wound. A wound has to be dressed. You see, you are teaching the nurse how to do that.
Yeah, of course.
Just tell us a bit of what's happening at it's called Johhaness.
Johhannes College of Medical Health Sciences. Yeah, of course, within the training setup, there are areas or levels of training that you can do theoretically, but then again, there are those that have to be held in person. So even as you train as a nurse or a certified nursing assistant, there are areas that I'm sure that can be handled theoretically, and that can be done online.
Okay.
But then again, there are areas where a student has to be in person to get through that clinical experience, or trained on clinical skills before they will be handed over now for clinical attachment.
Okay.
Yeah. So there are areas, of course, because of the different tough economic times, someone would probably love to do a job while they train. So there is a possibility of you doing some of these trainings online, while we have different sections of your training that we are going to do for you. That is something we do at Johhannes College of Medical and Health Sciences.
You have to sit in a classroom to learn that.
Yes, there are sections that we can do online, and then there are areas when you have to come, because we have to take you in a skills lab where you're going to have this hands-on clinical skills.
Okay.
Yeah.
You see, if it's a normal school,
yes,
you'll sit in a classroom to learn, right?
Yes.
But this is nurses, and nurse, you don't sit in a classroom, you sit in a hospital.
Yes.
Because patients are there. Or how do you do it? Because it's a nurse aide.
Yes.
A nurse aide working with nurses. I think the bad way of looking at them is a nurse who is working with a nurse.
Yes.
But this nurse is in a hospital.
Yes.
Okay.
Yes.
The way she's handling patients, the way she's serving the patients, or he is serving the patients. So the nurse aide is learning from that.
Yes.
Just tell us a bit of that.
So just like in the setup for training, of course, there's a strictly training period where you are interacting with your tutor theoretically and then practically. So there is this time when the student is just going to be a learner. Of course, being exposed to the real experience of having to interact with patients, and that is done within a skills lab in the school yet. So after their training within the school, which can be, if theoretically, can be done online, and then when the practical bit of it is needed, then they have to be available in person. But after the training, again, there is a placement period, an attachment period, I could say that.
Okay.
Then that is a period again now we take them out of the school setup to now
to go and interact with
the real patients and the real nurses that they are going to work with.
Okay.
Yes.
Okay. These doctors were given a year of internship.
Yes.
After graduating.
Yes.
Why is it not with nurses? Because they don't need that kind of exposure?
No. Of course, nurses go through it. The nurses who are taking their undergraduate also go through a year of internship.
Okay.
And nurses who are going through for diploma courses actually go through rigorous interaction with the students.
Okay.
Because for them, immediately you're admitted into college, you only have like around 4 months in class.
The rest of the time?
No, it is separated. So they have it's a mix up of theory
and practical.
Theory and practice all through, as opposed to nurses who are taking the undergraduate who probably have the whole period, probably as short instances during the study, and then now go for their full-time attachment after graduation. Students who are taking their diploma courses have a lot of periods during their studies that they actually go and stay in the clinical area.
Okay. But then there is an element. I've worked in a private hospital setup myself.
Yes.
And I had a very big difficulty working with the degree holders and the graduates. They are not trained to treat patients. They're trained to manage those who treat patients. Now, KMTCs or TVET institutions have come to correct that, because they bring in hands-on workers who have trained to interact with the patient, not the management side.
Okay.
Am I the only one who is seeing this?
Of course, the reason why I've laughed that hard is because that is an ongoing, enraging debate that is not ending today. There's a sibling rivalry between diploma nurses and degree nurses. But as from my point of view and from my experience, I would urge anyone who probably would be interested, and more so now that a lot of our education in this generation is not our passion. Is not our passion for what we do is not as generated from childhood as it was very many years ago. So nowadays we jump into a course because my uncle is a successful nurse.
Okay.
Yes.
Okay.
So then I can do nursing. I have the grades and there's the money.
It's something you pick along the way. It's not in you.
Yes.
Well, I can still do nursing. I can do this, but I can still do hairdressing on the sides because hairdressing is in me.
Yes.
So you do the nurses, then you go and do hairdressing.
Yes.
Or you can do nursing here and you can run a cyber.
Yes.
Or you can run a posho mill or something else. What is in you, which you have developed at school, you left it and developed nursing. That's what you're saying.
So in my experience, even during employment interviews that I've had, you'd find a nurse who has gone through their diploma and then now upgraded to degree to be more efficient and very hands-on.
Okay.
And you are at peace with them even when they're with students.
Because now they I'm getting the point. I'm not able to bring it out. But then I've gotten it. You see, they are hands-on.
Exactly.
But then they equipped themselves with better skills.
Yes.
Then they come back to give back.
Yes. Yes.
So they're better equipped to handle these guys.
They are pretty much. Of course, they are. I'm not putting aside those nurses who have done their undergraduate and are very passionate. You'd find people who have done their undergraduate straight from secondary school who are passionate about nursing. Then you see now this is a whole different breed of people. Yeah. Yes. But then you find a group who probably just went because their grades and they had the school fees.
Maybe by association.
Maybe association. Then those are the guys probably you're talking about, nurses who are very dry. Nurses who are very dry. They don't have the nightingales. The nightingales. Yes. So now that is where the difference comes in. But your parent probably who is watching and would love to create a nurse out of your child, then this is a personal opinion that you want to have them go through the diploma level training and then now escalate that to undergraduate.
Because that way they will deliver better value. Exactly.
From my experience, it would be super.
I have you see, we have another department in a hospital, dental. Yes. Who works in a dentist's office, in a dental hospital? Of course, apart from the dentist himself.
Apart from the dentist themselves, you are still going to meet a nurse. You are still going to meet a nurse who probably has specialized in that. Or there are dentist assistants who are now trained in institutions to help in those areas.
So these dental assistants, we also have dental technicians.
Yes, there are. These dental assistants are trained to be dental technicians.
Okay.
To help dentists work within their professions.
Okay.
Yes.
With those 2,000 equipments lying there, but we need to know which one goes on what teeth. Okay. I asked that specifically because that is the only area where patients tend to really have to make up your mind to go.
Umewezwa. You don't make up your mind. You are taken there.
You are on your end.
Yes.
As in the pain in your mouth, it's unbearable.
Yes.
You just have to go to a dentist.
Yes.
But then they're not very like this hospital setting where I'll go for checkup, I'll go for blood pressure. You see, I'll just pass by, I'll pay 100 shillings or 200 shillings, 500 shillings. It's not like that. Why is that set up like that? It's not very attractive to the world. Is it the training? The training has never worked on that human side of dentists.
Of course, the advancements in technology and even in healthcare has made it now very easy for you to walk in and do your dental checkup. I know it was not there. I know you're more aged than I, and probably from your experience, you didn't interact with. You only meet them in the main hospital when you've been referred.
Yes.
That now your tooth needs to be extracted. But there are a lot of dental hospitals that are coming up lately, and you can walk in. Of course, they're being given a face as an independent section of the healthcare unit that is also as crucial, just like the optical units, where you can just walk in there and have your teeth checked and cleaned, and probably you are helped way before. You remember those morning runs where by the time it is 6 a.m. in the morning,
you are supposed to run around,
and you have already gone. You're already waiting for the doctor. When our teeth are showing signs, we never take it seriously. So as opposed to that, those instances where you have to go to the hospital at 6 p.m. because you had the whole night in pain.
Yeah.
And now you have to go to the dentist.
Who wakes up at 10? Who wakes up at 10? Hello. Problem is, you see, a hospital, the way a hospital is, one hospital like this is actually a collection of very many organizations.
Exactly.
Yeah. The different units now come to, actually they're licensed differently.
Yeah.
The optical units are licensed differently, dental differently, pharmacy differently, lab differently. So they are all coming here to work as a unit, as one larger organization.
Yes.
Then we have a very strange person called ENT. They work with ears, nose, and what? Throat.
Yes.
Good. Now, these are specialists.
Yeah.
Do they have assistants?
Yes, they are. The advancements in the different sections within the healthcare sector has made it necessary for a lot of these units to be independent. So you see now, when they have become independent, then now they have to have probably a public relations, and that is why now you walk into a dentist, you walk into a dental hospital, you are going to be taken through the normal hospital procedures, and you just walk into the reception, to the triage before you see the dentist. That is the same way you're going to go through the ENT specialist as well. Now, when this came up, now we had to have technicians that are helping some of these dentists. Because the increased influx of traffic. There is a whole increase in disease burden worldwide, and it is happening everywhere. So that has called for the different healthcare sections to be at the forefront, so that patients not go through a whole, like you don't have to go to Vihiga teaching and referral. At the outpatient section, yet you had only a problem with your throat. Yes. So you walk into a specialized section where you are going to be helped. Now this has made it necessary for these sections to have their technicians. A technician who is specialized just for this section. Okay. So the ENT specialists as well have their own assistants. So those are the people you're training at Johhaness? Yes, those are the people we train as well. Okay. Yes. So if someone wants to come and train at your school, yes, what process do they need, or what qualifications do they need to have? Of course, the different training levels and the different courses have their levels of requirements. What you need is just get through our website or just call, and then we will help guide you. Of course, we have career counselors who are going to help you in identifying which course you're going to do. Okay. Of course, our phone numbers probably will be shared. Yes, as well as we'll have to share that. Yes. Then also the website. Yes. But before we do that,
the training methods.
Yeah.
You've just talked about the increased burden. You said what?
This is burden.
This is burden. It's increased.
Yes, it is increased.
And what does it? What is that doing to the specialties? Because, for example, dermatologists, we have what neurologists. Yeah, we have all those gists,
specialists.
Those.
Yes.
What is it doing to them when the burden increases? Is it, as in, do they have to go back to class? Or the support system, all you have to do is deal with the support system and you're done. You're done.
Now the increase in disease burdens in the country worldwide has necessitated for a lot of medical personnel to be needed to help in filling this gap. Because when a lot of people are sick, because of course the lifestyle diseases are coming up so well, we have the scourge of cancer coming up. Yet we still have our common communicable diseases here that still needs to be sorted. Then that is what necessitated for an increase of some of these educational institutions that are offering medical and health science courses. So then we are able to train more, so that we have a lot of specialists out there, and even those specialists to have people who work with them. Because remember, specialists would need someone even to help them in running some of their some of their work.
You see, people who are desiring, like, I want my child or myself to go. My cousin went to a medical college when he was 45, so there is no age limit. Anyone can go to school and learn something, right?
Yes.
So what do you want to tell this person who wants to go to, who may be interested, maybe is passionate, maybe they've been practicing it? I've seen people who have practiced it, but they never went to college.
Not trained,
not trained. So what's your advice to this person? Then we end there.
Okay, of course, we welcome all of them to Johann's College of Medical and Health Sciences to get trained. You can find us on all the social media platforms. There is in the last intake I had in my former college, I actually admitted a gentleman who had retired from public service, and was coming back to train as a nurse. So
because Andaga went to Australia or what? Because there is also that opening to go and work outside there.
Of course, there is that opening, and right now we have a partner who is taking in students from our college who are trained on certified nursing assistant and theater technicians. So those who train with us are guaranteed to have paid internship opportunities out in Germany right now. Which is there. So and just like I told you, for the general training, there is no age limit. Anyone would come back. Something that probably pushed me into this, and what drives me, is I have lost loved ones in the line of healthcare because of negligence. And so at my position right now, I would love to train a healthcare professional who is really humane and knows that even as I am handling this patient here, someone else in a different town is handling my relative there. So then it is only proper to deal with them so well, and that is what we are driving at Johann's College of Medical and Health Sciences. That you have to be a very good professional, and students who pass through our hands are going to be very good students, and we are growing to be one of the biggest medical colleges in Western Kenya. Yes. That's
fine. Maybe you can just mention the website.
All right. Our website is www.johannesmedicalcollege.ac.ke. Phone numbers are 0739 21 6209. Maybe I could repeat that again. 0739 21 6209. We are located in Kisumu, in Tombo Estate, just opposite Kenya Breweries Limited. In the social media, you can follow us at Johann's Medical College. You have any questions, inquiries, we are always able to help you get help in regards to medical training.
Well, we've just come to the end of the show. This is, wow, very exciting.
Thank you.
You make me want to learn more. You see, when I worked in a healthcare facility, I was this type of a guy who would want to go for the best.
Oh yeah.
So I'm sure you're bringing out the best, so they don't get turned down. And people who interview them like me.
Yes. We are training the best. We are training the best, and we are going to have the best.
Okay.
So that anyone who you give your CV and tell them that you have trained at Johhannes College, say that we know this college.
I remember we had a doctor from Egypt, Dr. Magda.
Yeah.
She was a very good general practitioner. She did perfect. And you see, when you get several Dr. Magdas in this world, especially from Johhannes, I think the world will be a better place to live.
Exactly. And that is our mission.
Yes.
Yeah.
It's 10 o'clock. On behalf of the director of the show, Kevin Kibet, we look forward to coming back here on Tuesday next week with more conversations on other stuff that we'll be interacting with. Leave those comments on West TV _Kenya on X, Facebook West TV, and on YouTube West TV. We're on TikTok West TV, on Instagram West TV. You can follow me at Mr. Kitui, and you can also follow me on my Facebook page, Okwasimite CKS. See you next week on Tuesday. This is CKS.